This is about a recombinant vaccine targeting the fish parasite Ichthyophthirius multifiliis. And it is actually quite a problem with this white spot disease all over the world, because it's a unicellular parasite that attacks all kind of freshwater fish, and it penetrates the gills and the skin and fins, and then these trophons in the skin and the gills and fins, they actually escapes and multiplies very fast in the environment and attack the fish within a few days again. So one white spot will develop into thousands within a few days, and it causes a quite high mortality in all kind of fish species, although we have different genetic setups. So some species are less susceptible compared to others. But our pet animal, for example, the rainbow trout, is highly susceptible, and this parasite is a problem in the European fish farming, and creates a lot of economic losses. So the rainbow trout is clearly seen up here at the left top, where it is actually attacked by the theront, which we see at the right corner in the top there. The life cycle includes the trophon in the skin or the gills or the fins of the fish. You can see that we have the white spots, the trophons in the skin here. They are reflecting light, and whereby they are seen as a very nice white spots. And the trophon escapes after a while and swims around in the water as a tumult. It settles and creates a cyst around it and multiplies, producing a lot of termites, which are escaping as theronts and then penetrate the fish. And this life cycle is temperature dependent. So the higher the temperature is, the faster the propagation of the parasite. So we can infect fish in many ways, and this experiment here is where we infected 1,000 rainbow trout with a size of around 9 to 10 grams, and we simply did it by having them in one common garden pool, where we added 60 theronts, infective theronts per fish. So and after a few days, we actually saw the development. And within a few generations of the parasites, which are only a few days, then we got a very high mortality. So we can see here, if left untreated, this parasite will kill actually almost 98% of the fish in a pond. So that is the reason that also the parafish control is actually looking for some effective substances which can keep this infection to an acceptable level. So this is what we would call a very pathogenic parasite. So we would like to try to prevent the infection by using a vaccine. But how to make a vaccine? I can tell you that we have several times made a very basic and old-fashioned vaccine by producing a homogenate of killed parasites, and it will give some protection if we injected IP. This is, of course, not a path we can follow in the future, because we need to produce a lot of antigens. So we used an approach which is called artificial intelligence, which was based on the genome of the parasite, was able to identify some protective antigens in this parasite. And based on that, we tried to make a recombinant subunit vaccine. So this artificial intelligence computer program is called Eden, and it's successfully identified a number of B-cell antigens. Actually 12 proteins were identified, and we tested some of these, and 3 of them looked a bit promising, so we continued with those. So this is from our trial, where we had some controls which were only injected with PBS, and then we had an adjuvant control with aluminium hydroxide, and the subunit vaccine, and the old-fashioned parasite vaccine. Here we have it here, which was based on homogenized killed parasites. And when we challenged the fish, we could see that we got a significant reduction of trophons in the skin, the white spots in the fish which were vaccinated. So for our first look, it looked quite promising. We could also look at the mobility after incubation with serum from the fish in the different groups. And we could see that the motility of the parasites, it was reduced when it was incubated with the vaccinated fish. Here at the lower right corner, we can see the therons, which is it can really it really looks like a ciliate. It is not the same as Jesus talked about, but this is also a ciliate here. So of course, when we talk about the vaccines, we look also into if these fish vaccinated against the parasites are producing specific antibodies against these antigens. And here we could see that the fish vaccinated with at least protein 10 and 11, as we call them, they actually produce some antibodies after a while, and they were at the same level as the antibody produced in the fish vaccinated with the old-fashioned parasite homogenate. So actually, we use the recombinant protein 10 for further studies and in the future here. And after this, we contacted our good parafish control partner W42 and SCAR in Germany, and he actually tried to produce this antigen in his Pichia pastoris vector, but and it was quite a lot of work. I think he had sweat on his face after doing this, but he succeeded in producing some of this protein 10 in a good batch, which he sent both to us in Copenhagen, and he sent and we shipped something also to our partner 10 in Hungary, and so where it was tested both in rainbow trout and in carp. But especially this antigen produced in Pichia didn't look as well as the first trial we did. But we have not finished this work yet. We still have to check the antibody production and the other reactions in the fish. But at least we think we have one line here which can maybe be one part of a multifactorial approach toward control of the white spot disease in for example, rainbow trout. So this is, yes, but I'm finishing off now here. I think we have a possibility to improve the health of the European farmed fish here in a sustainable way, but we still have some way to go before we have the final vaccine, which can get to the market and protect our fish in European aquaculture.